I'm a social worker in pediatric cardiology, so I work with the Children's Heart Center here at the hospital, and I work both on an inpatient as well as an outpatient basis. So I see 100% of our kids who come in for open heart surgery or have any kind of a cardiac diagnosis. And then I'll follow them in our clinic when they come back for follow-up appointment. So families are under a tremendous amount of stress when they're here. You know, families who are diagnosed right after a baby is born have a lot of questions in their minds that they are forced to handle while still dealing with, you know, just having a new baby. So not knowing what to expect, I think, is hard for families. It's hard even when you come in and you have a teenager who's going to be coming in for heart surgery, and you have to hand over your child that you've cared and loved for years to a team of people to take care of them is unnerving. You know, I think families trust our medical team, but it still is an extremely difficult time for families to go through. I have the opportunity to work with families when they're here and help support them through this process. You know, I like to consider social work as kind of a point person for families while they're here. It's somebody to go to if they have questions, if they have any concerns, whether it's about the basic needs even sometimes. You know, the lodging, where am I going to lay my head at the end of the day when I'm exhausted and my child's gotten through surgery and now I can relax a little bit. So I help set up things like the Ronald McDonald House for them, or I help link them with other agencies in the community who can help support them while they're here in the hospital, sometimes for extended periods of time. So it's providing families with support, not only short-term but also long-term, because some of our families can be here for a month, 2 months, or 3 months. I think that we are really embracing family-centered care here, and I think that parents provide some of the best medicine. I really think that a child, when they wake up from surgery, no matter how great the nurses are or how good the doctors are, the first thing they look for are those parents. They want to be comforted and soothed by them. So if we can't keep the family feeling good and taking care of themselves, then they can't be at their best to help their child recover from heart surgery. We're lucky. The resources are improving, you know, I think, for the kids with heart conditions. We, here in the hospital, have an amazing hospital. We have a Ronald McDonald House in the hospital. It's only the 4th or 5th in the world, I think, to have a house in the hospital, so families can be 30 seconds away from their child's bedside and still get a good night's sleep. Which is really, again, it helps families to recover from their own stress of having to deal with a child having heart surgery. We're lucky we have another Ronald McDonald House that's off-site also for all families outside of Monroe County, so they have an opportunity to come in and can stay close when they're living miles away from home. It truly becomes a home away from home while they're here. We have some great community resources that we tap into for families who are coming from great distances, who help support families when they have to travel for medical care. And we have some amazing local organizations. Mended Little Hearts is a great parent network, a support group that helps families appreciate and have an opportunity to talk with other families who have been through something similar. I love what I do. I think I work with a tremendous team of people. I come in every day, and the interdisciplinary team that's here is amazing. From the secretaries and the administrative staff to our nurses and doctors and surgeons, people love what they do here, and that really shines. And so it's a great opportunity to work with people who are advocates for the patients and the children that are here in the hospital. It's also a huge honor to work with families. I get to meet amazing new families every day that I'm here, and working with those kids and families is truly a highlight of my day. Being able to give them a hug and send them on their way once they've recovered from surgery is such a rewarding opportunity that I couldn't imagine not doing.